Greetings, doctor. My name is Kirubalani Maruthuvanan. My matrix number is 012022091161. And today, I would like to present about acne. So, before we proceed, let's see the anatomical structure of the organ involved for this particular topic. So, as you can see, doctor, here I've attached an image. So, yeah. Acne issues. So, a skin is the body's largest and primary protection organ, as we know, whereby it covers its entire external surface and serving as a first order physical barrier against the environment. Okay, and the skin is primarily made up of three layers, where the upper layer is the epidermis, the layer below the epidermis is the dermis, and the third and deepest layer is the subcutaneous tissue. The epidermis, which is the outermost layer of the skin, provides a waterproof barrier and contributes to skin tone. Whereby the second is the dermis, found beneath the epidermis, which is the second layer, contains connective tissue, hair follicles, blood vessels, lymphatic vessels, and sweat glands. And the deeper subcutaneous tissue is the third layer, also known as the hypodermis, is made of fat and connective tissues. Okay, and its function includes temperature regulation and protection against ultraviolet, which is the UV light, trauma, pathogens, microorganisms, and toxins. The skin also plays a role in immunologic surveillance, sensory perception, control of insensible fluid loss, and homeostasis in general. So the skin is also highly adaptive with different thickness and specialized functions in different body sites. So, for as I mentioned just now, we are discussing. I'm presenting on the topic of acne. So, acne commonly appears on face and shoulders, and it may also occur on the trunk, arm, legs, buttocks, on the back of our body, and so on. Okay, so let's see what are the symptoms of acne. So first, I would say crusting of skin bumps, cyst. Apart from that, papules, as you can see in the image, papule is a small red bump, and pastules is also a small red bumps, but containing white or yellow pus. Okay, so pustules is the common acne that most of the people have. Apart from that, we also have redness around skin eruptions, whereby when there's people around here, when there's pustules, around the pustules, there will be redness around the skin eruption, which might give for some people, it might be irritating as well. It might give some irritation. So that is also a symptom. Apart from that, scarring of the skin, whiteheads and blackheads. Whiteheads and blackheads commonly can be seen around this T zone, okay, especially on our nose and also on the chin part. Okay, so let's see what are the treatment and prevention of this disease. So basically, according to dermatologists and other professional doctors, skin doctors, there are lots of treatments that they have been conducting. It's being conducted as we know that laser or treatment, skin treatments is being carried out around the world, even in Malaysia. But basically, for today, I would like to explain about the basic self care that we should do to prevent ourselves from acne. So, the steps that we can take to prevent from acne is clean our skin gently with mild, non-drying soap such as Dove, Neutrogena, Cetaphil, CeraVe, Basics, Nivea, and also other cosmetic products that has been tested by dermatologists. Okay, because we're not supposed to buy any random products just by the in a drugstore, which means in a pharmacy. We should always consult with dermatologists, or else we should check the container whether do they state it. Is there any statement saying that tested by dermatologists or not? Okay, apart from that, it's advised for the people who's affected due to acne to look for water-based formulas for cosmetic and skin creams, such as for our foundation, for our moisturizer, for our cleanser, for our toner. It's always better for us to use a water-based product because it has less oil. The more the oil it is in the product, the denser the cream will be, which will give a thick layer on our skin. Okay, so the thicker the cream that we apply, the more the clog will happen in between the pores. So this might produce more acne. Okay, and apart from that, normally it is common for us to have oily face, am I right? As sometimes some people will have oily face issues, which will be really bad, which will be really severe. For some people, I mean, for commonly for most of us, it's just normal, whereby it releases sebum, right? So it's just normal for us. But as a student from my side, we are coming to the campus in the morning and our class is until the evening. So for the whole day, we won't be able to wash our face to refresh ourselves. Am I right? So during this time, when we apply the cosmetic which is really thick, this might affect our skin by clogging the pores and producing more acne. So it's always advisable for them to use water-based cosmetic products. And yes, of course, sunscreen is important, where they can use water-based sunscreen. Okay, and apart from that, we should also remove all dirt or makeup and wash once or twice a day. I mean, our face should be washed once or twice a day, including after exercise. Okay, we shouldn't just let our face like that. We should always wash and clean our face. And yes, apart from that, we should also avoid scrubbing or repeated skin washing. Yes, we should wash our face. It's either once or twice a day. It doesn't mean that we should wash every time. Okay, this might give any eruption, any irritation to our skin because we are washing again and again using our soap, isn't it? So this might also give any irritation to the skin. Okay, and apart from that, we can also wash our face using good products, natural products, rather than using mercury. Yeah, it's advised for us. I mean, it's more advisable for us not to use the mercury products. So apart from that, let's see what are the things that we shouldn't do. So first of all, try to not aggressively squeeze, scratch, pick, or rub the pimples. This can lead to skin infections, slower healing, and scarring. Because when you squeeze the pimple, definitely there will be a scar after that. Where it'll take some time for a clear skin. And apart from that, this might give some irritation as well. And apart from that, our bare hands, when we touch them with our bare hands, we wouldn't know what is there on our hand. Am I right? We wouldn't know what is there on our hand. So it's better for us to not pop out our pimple, just leave it in such, or you can use pimple patches. Apart from that, avoid wearing tight headbands or baseball caps or other hats, and also avoid touching our face with our bare hands or fingers, and avoid just keep on touching or scratching our face again and again, and avoid greasy cosmetics or creams or oily or denser creams. And yes, the important part, do not leave makeup overnight because this might be a factor to produce some sort of bacteria around our eye circle or even on our face. Okay, so yes, as the last part, I will just explain about the prevalence for acne, where acne, as we know, is a common skin disease affecting approximately 9.4% of the world's population, with the highest prevalence in adolescents. It affects over 90% of males and 80% of females in all ethnic groups. And yes, the prevalence of acne and adolescents and adults varies among countries and ethnic groups. So yes, this is all about the acne issue that I have presented to you, madam. Thank you so much for your time, doctor.